Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bibasilar Atelectasis. Bibasilar Atelectasis is the collapse of the lower parts of both lungs. It can cause symptoms such as shortness of breath and a productive cough. The most common cause is a surgical complication from general anesthesia. However, there are other causes, such as tumors, blood clots, obstructions, or other reasons for lung pressure changes. /r/n/r/n The treatment for Bibasilar atelectasis depends on the underlying cause and typically involves breathing exercises, devices, and medications to re-expand the lungs. /r/n/r/n/Verywell, Joshua Seongrnrn Atelectasis occurs when the airways collapse, and air can't reach the tiny sacs calledalveoli, where oxygen and carbon dioxide are exchanged. This causes hypoxia, in which organs and tissues don't get enough oxygen. /r/n/r/n Bibasilar atelectasis occurs when the lower lobes of the right lung, which has 3 lobes, and the left lung, which has 2 lobes, collapse. /r/n/r/n There are 2 types of atelectasis, obstructive and non-obstructive. Obstructive atelectasis happens when something is blocking the airway, such as a tumor or mucus plug. Non-obstructive atelectasis occurs due to external pressure on the lungs. /r/n/r/n Examples of conditions that can cause this include pneumothorax, buildup of air around the lungs, and pleural effusions, buildup of fluid around the lungs. /r/n/r/n Depending on the cause of the atelectasis, Bibasilar obstructive or non-obstructive atelectasis can occur. Bibasilar means that it affects both the right and left lobes of the lungs. /r/n/r/n Symptoms tend to develop suddenly and involve /r/n/r/n As the condition progresses, symptoms worsen as oxygen levels decrease. If left untreated, Bibasilar atelectasis can lead to a severe drop in blood pressure, tachycardia, rapid heart rate, and shock. /r/n/r/n There are obstructive and non-obstructive causes of basilar atelectasis. Obstructive causes physically block the airways, while non-obstructive causes place pressure on the lungs, making the airways harder to fill. /r/n/r/n Major surgery with general anesthesia is the most common cause of Bibasilar atelectasis because it can involve both obstructive causes, in the form of mucus, and non-obstructive causes, in the form of anesthesia. /r/n/r/n Obstructive causes of Bibasilar atelectasis include /r/n/r/n Non-operative causes of Bibasilar atelectasis include /r/n/r/n It's important to note that sometimes people hear the term collapsed lung and think of a pneumothorax. Pneumothorax and atelectasis can cause similar symptoms. /r/n/r/n However, in a pneumothorax, air pressure builds up in the chest from one of several causes and makes it difficult for the lungs to expand. In atelectasis, the airways are blocked by mucus, tumors, or other causes, making it hard for the lungs to expand. /r/n/r/n The risk of Bibasilar atelectasis increases with age. The risk is the same whether you are assigned male or female at birth. /r/n/r/n Other factors that can contribute to Bibasilar atelectasis include /r/n/r/n If your healthcare provider suspects you have atelectasis, they will perform a physical exam. If there is a collapse, your breathing sounds may be quiet or absent in the lower areas of your lung. /r/n/r/n Your healthcare provider will also perform percussion by gently tapping your chest. The sound of the tapping will be different over areas of atelectasis than over healthy areas of the lung. /r/n/r/n Additional tests may be ordered to confirm the diagnosis, including /r/n/r/n The treatment of Bibasilar atelectasis varies by the underlying cause. Irrespective of the cause, The ultimate goal is to re-expand the lung to its normal size. A combination of approaches may be needed. /R/N/R/N mild cases of atelectasis may resolve on their own or quickly once the cause is identified and treated. /R/N/R/N non-drug intervention may include /R/N/R/N medications can improve the clearance of mucus, including /R/N/R/N if there is an underlying cause of atelectasis, it needs to be treated to prevent further collapse. This may involve surgery and chemotherapy for lung cancer, fluid drainage for pleural effusion, and antibiotics to treat lung infections or complications of cystic fibrosis. /R/N/R/N Bibasilar Atelectasis can cause severe complications if left untreated, including /R/N/R/N call 911 or seek emergency care if you develop the following symptoms: /R/N/R/N The outlook for Bibasilar Atelectasis is generally good, mainly because it usually occurs in the hospital and can be immediately treated. When treated early, atelectasis can be resolved without long-term lung harm. /R/N/R/N if not treated early, Bibasilar atelectasis can cause scarring of lung tissues. This contraction of these tissues can lead to another form of atelectasis called cicatrization atelectasis. /R/N/R/N cicatrization atelectasis a form of disease in which severe scarring of the lungs, pulmonary fibrosis, reduces their ability to expand. The outlook is far less favorable because the loss of lung volume is permanent and sometimes progressive. /R/N/R/N mild atelectasis that resolves quickly generally does not affect life expectancy. However, severe or widespread atelectasis may be life-threatening, especially in someone with another lung disease or illness. /R/N/R/N Additionally, young children and infants may be more susceptible to severe complications from a lung collapse due to a mucus obstruction or other causes. /R/N/R/N major surgery with general anesthesia is the most common cause of Bibasilar atelectasis. To prevent postoperative atelectasis, your healthcare providers will advise you to stop smoking before your surgery if you are a smoker. /R/N/R/N after surgery, there are 4 things you should do to prevent atelectasis. /R/N/R/N Bibasilar atelectasis is the collapse of the lower lobes of both lungs, most often in people who have undergone surgery with general anesthesia. Symptoms include wheezing, shortness of breath, a wet cough, and rapid, shallow breathing. /R/N/R/N Bibasilar atelectasis can be diagnosed with a physical exam, imaging tests, and occasionally a minimally invasive procedure called bronchoscopy. The treatment may involve breathing exercises, airway clearance, and medications that help open the airways and thin mucus. The outlook is generally good with the appropriate treatment. /R/N/R/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.